On the occasion of World Hypertension Day, we have with us Dr. H.K. Chopra from Delhi. Welcome Dr. H.K. Chopra. Doctor, can controlling blood pressure prevent kidney disease completely?
If it is a hypertension-affected kidney disease, of course, it's prevented completely. But there are many causes of kidney disorders. There can be a metabolic cause, patient may have dyslipidemia, obesity is the cause, there can be diabetes, angiopathy, there can be vasculitis, there can be collagen disease, there can be autoimmune disease, and there can be so many diseases of kidney like glomerulonephritis or pyelonephrosis. If there is no primary kidney disease and only hypertension is the cause, and if we control the hypertension, I'm sure we can completely reduce the stress over the kidney, and kidney can be normal till the age of 80 or 90. I have a patient who has only one kidney, but he is hypertensive. One kidney at the age of 90 with hypertension. We have controlled BP so well, he is 90 and he has no problem at all. There is the control of blood pressure, which is more important, which causes increased peripheral vascular resistance and poor renal perfusion. And that is responsible for a CKD or kidney disease.
Doctor, can hypertension during pregnancy be dangerous?
I think it's very important. Hypertension at any point of time, right from the childhood to the elder age group, is dangerous. And when you're pregnant, it's going to be more dangerous because the health of the mother and the health of the baby both are in jeopardy. And uncontrolled hypertension at that time may give rise to premature labor, may cause IUGR. IUGR is intrauterine growth retardation. I've seen a lot of families where they are not able to sustain the baby beyond 8 months because there is a IUGR, intrauterine growth retardation. So blood pressure control during pregnancy is very meticulously required, and we have to make sure that the sympathetic overdrive is maintained and the advanced overdrive is maintained, and more frequent checkup of the blood pressure and regularly medication. Meticulous control of the blood pressure is the need of the hour during pregnancy to prevent the complications both for the mother as well as for the baby in utero.
Doctor, what daily habits protect both heart and kidney health together?
I think it's very important, dear friends, that there is a heart and kidney axis, and the hypertension is a very, very important variable. According to me, if you see the prevalence of hypertension is 40% at the age of 40, and you become 50 at the age of 50, it is 50%. At the age of 60, 75% of people are hypertensive. And the most important data which is published in the ICMR as well as by the World Health Organization and the Ministry of Science and Technology, uncontrolled hypertension is seen in 90% of patients. And uncontrolled hypertension affects the kidneys very badly because all the glomeruli as well as the tubules and the nephrons, they get remodeled, and the remodeling causes fibrosis, and this is responsible for CKD, stage 1, stage 2 and stage 3 onwards. So this relationship of an uncontrolled hypertension and vascular health should be known to each and every one. Every vessel, which are 40 billion capillaries in us, they get affected with the uncontrolled hypertension. They may be in the kidney, they can be in the eye, they can be in the coronary arteries, they can be in the brain, they can be in the mesentery, or they can be in the peripheral vessels. So when we take care of these vessels, we reduce the peripheral vascular resistance and make them no organ damage. So our approach has to be vasculocentric now and not organ-centric. So metabolic centric is fine. Inflammatory is another process, fibrosis is another process, and vasculocentric approach is the need of the hour, which I think we should highlight on the World Hypertension Day.
Doctor, how often should BP patients get their kidney function tested?
Whenever a person is hypertensive, and depends on the age of a patient. If a patient is beyond 40 or 45 years of age, I personally feel if he's just having a microalbuminuria, every 6 months it should be checked. But if a patient has got stage 2 or stage 3 CKD, then of course the frequency of checking the albumin increases. So the increase of urinary albumin check depends on the degree of CKD. Is it CKD 1 or CKD 2 or CKD 3 or stage 4 or stage 5? So since uncontrolled hypertension affects the kidney functions, so we have to be very, very careful at what stage the kidney is. Accordingly, we should decide. But usually, if a person is hypertensive at the age of 40, we should do it at least once in 6 months.
Doctor, what message would you like to give on World Hypertension Day?
My message is very simple, ladies and gentlemen. We all should launch Mission Hypertension. It's not the doctor's domain. It's a public domain also. mission hypertension are launched, this should be the theme you know very well, is control your blood pressure together. Together means not only a doctor, not only a nurse, but also the public should know and they should help us in controlling the blood pressure. So most important thing is controlling the blood pressure is the need of the hour. Number two, regulating blood pressure. Everybody after the age of 40 or 50 should monitor his blood pressure on daily basis. I do my blood pressure every day to see the blood pressure normal and I regulate my medication. So regulation of lifestyle optimization is possible if you know your blood pressure. If you don't know your blood pressure, how can you regulate? And number two, if you think the doctors will do it, I think it's a fool's paradise. Public has to be involved. Public domain is involved. And we should launch mission hypertension in a global way so that everybody is aware of the blood pressure. Even we should launch special provision of blood pressure at the shopping complexes or at the areas where more public is there, like a railway station or at the airport. Machines should be there so that everybody should know that when they're free as to how much is the blood pressure. So need is tremendous, and we should see that uncontrolled blood pressure may cause heart attack, brain attack, leg attack, eye attack, and even abdominal attack. So we must create some kind of what I call as awareness in people's mind that if the blood pressure is not controlled, any organ can be affected for anybody at any age. So I think this is very important. Restriction of salt, no sedentary habits, sleeping adequacy at least for 6 to 8 hours, and no consumption of saturated fat, alcohol in great limitation, no smoking, regular exercise, and no pot belly, please. They must all have a reduction of central obesity. The gut should be about less than 90 centimeters in men and less than 80 centimeters in women, which is the need of the hypertension. All the factors which are responsible to enhance hypertension should be controlled right from the time we are born till the age of 90. It is in our hands. And a periodical regular checkup, every patient should go, and we should know blood pressure right from the age of 20. Everybody should know the blood pressure at the age of 20 so that we don't fall victim to a vascular insult, which happens, and we see a lot of youngsters falling victim to a stroke or heart attack and kidney problem.
A public awareness initiative for healthy India.